Right now we have a workshop called Beyond the Hospital. It's going to be led by Dr. Deborah Ward from the UC Davis Betty Irene Moore School of Nursing, and so I'm sure you guys are in for a real treat. I'll hand it over to her. Can we give her a round of applause?
Thank you very much, everybody. Everybody deserves big credit for sticking it out after lunch and on a Sunday. I'm happy to be here with you and to people who will be able to see this via another medium. So presumably the people who are here are thinking about nursing. Are there nods? Great. I'm going to talk with you today about the highly evolving field of nursing. And we're just going to go across the top of the iceberg, but I hope I pique your curiosity and answer some of your questions. So the first one is, where do nurses work? Everywhere. Excellent response. They work everywhere, but lots of them work in hospitals. About 60% of registered nurses in the United States work in acute care hospitals. And what do they do there? Oh, that's not true. I'm so sorry. Great try. They monitor terrible, dangerous situations, right? So they are in charge of patients in the ICU. They're in charge of patients in the emergency room who come in with deadly injuries, and they are caring for them. They are in charge. They are the eyes and ears in the acute care hospital, right? So they are the people who know when things are going wrong and when things are going right. When they administer medication, if they know that medication to be wrong, do they still administer it? Absolutely not. It's a piece of their education and their professional training that they must know the reason for any medication that's being administered, know all about its pharmacology, and along with their physician colleagues, make decisions about whether that medication is safe to administer or not. So they are in the acute care setting, they are in charge of everything from little things to big things, and they are the watchdog for the patient, the guardian of the patient. So they do all kinds of interesting things in hospitals, and lots of people want to be nurses who work in hospitals. And if people have questions about the hospital life particularly, I'm happy to answer that. But I want to talk with you a little bit about them working in places other than hospitals, because they always have, and in the future, they really will work in places other than hospitals. In the future, much more of nursing is going to take place outside the acute care setting. So those of you who've always known that you want to be a pediatric intensive care unit nurse, there's still a future for you, but you should be thinking about 50 more interesting things you could be doing with children besides working in the pediatric ICU. So in the past, nurses worked mainly in homes, actually, in private homes, before the birth of the American hospital. And they did work in institutions, but many of them weren't hospitals at all. They were schools and orphanages, of which there in the United States once were many, and now there are many fewer. They worked in rest homes or nursing homes or care facilities for all sorts of people. They worked in sanitaria. Who knows what a sanatorium is? Oh, so the people in the back. This is like the Dave Letterman's band raising their hands in the back and saying, which of you have gone to medical school in the West Indies? And all of Dave Letterman's band raises their hands and said, we went to medical school in the West Indies. Okay, the cameramen can't answer. Do any of the people who want to think about being nurses know what a sanatorium is? on your history grade. It had to do with tuberculosis. So in the day when tuberculosis was a massive scourge in the United States and around the world, there were tuberculosis hospitals, and the nurses were in charge of that enormous piece of care in the United States. And of course, they worked in prisons. They always have, and they always will, especially if we decide that prisons is going to be as big a part of our public expenditure as we currently have. And they work as public health nurses. So what does a public health nurse do? Good, you rectified your previous wrong answer perfectly. That was excellent. Somebody else needs to speak up, though, in the audience. What do public health nurses do? They take care of the public health. What? They treat the underserved. They may work in clinics. They may work in particular programs that public health departments put together, like the flu shots for everybody, or they may work on dental care issues, or they may work on all kinds of things that we have to, with water cleanliness and safety, with encouraging good nutrition for young mothers and babies. They may do all kinds of things that public health institutions are concerned with. There have been tons of public health nurses in the past. There was a decline in the number of people who were doing that work, and then recently, the public health infrastructure is starting to build up again, and the future for public health nurses is going to be big. And we can talk more about that and answer more questions about that too. So, what do nurses do now, and what are they going to do in the future? I'm going to think particularly with you about them in the future. So, are there certain people here who are thinking to themselves that they might want to one day become a nurse practitioner? Do people know what a nurse practitioner is? I'll tell you a silly story. Oh, maybe I shouldn't even tell you. It makes me look like such an idiot. But when I got into nursing school, I was a college graduate. I went to a school, a MEPAN program, right? A school, a nursing education for people who already had a bachelor's degree. My first degree in nursing was a master's degree. And when I entered this program, I was pretty ignorant about nursing, and when I applied to this program, and somebody said to me, "Would you like to be a nurse practitioner?" And I didn't know what it was. So, of course, this is an admissions interview, so what do you think I said? I said, "I'd like that very much. It would be an excellent idea. I'm sure I would be an excellent nurse practitioner." And then I learned about what a nurse practitioner was. So a registered nurse with additional training, right, who will come to treat patients in a variety of settings, and they can be as a nurse practitioner, family, adult, geriatric, pediatric, as a midwife, working to care for pregnant mothers and deliver babies, as a clinical nurse specialist in a hospital. So for instance, in a burn unit, the clinical nurse specialist who is the expert nurse in the care of burns. And even, what's happening more and more in hospitals is as a nurse attending. We often speak about attending physicians, who are the physicians in charge of all of the young physicians in training. And increasingly, we will have nurse attendings in hospitals and other settings, who are the nurses in charge of all the learners and the younger professionals in the setting. So advanced practice nursing is going to grow by leaps and bounds. And what's one of the things that's going to make that happen that just went into effect on October 1st? Obamacare, the Affordable Care Act. As more people are eligible for covered health care through an insurance plan, the need for care is going to grow. And who's going to provide that care? Certainly our physician colleagues will contribute to that, as will all manner of other clinicians, but nurse practitioners and physician assistants will be one of the largest growth sectors to meet the need of this increased number of people who come to care in the United States. So you can think about advanced practice. What do you think it means to be a nurse informaticist? Yes. And what kinds of technology? We're going to have to let our person in the middle, who's such a good answerer, let somebody else answer. What kind of technology do nurses have to work with? Sure, or new treatments. They need to, they get a patient into their setting and has a condition the nurse doesn't know anything about. She needs to go and look that up and find out right away. That's good. But think about just sort of the operations of work that happens. Yes. Yes, the electronic health record, right? Gone are the days, and we're so happy they're gone, when the records were these manila folders of files set up in a room. And so if you went to a hospital or an emergency room somewhere else, and your medical record is back in Merced, and you're in the emergency room in Visalia, what the heck are they going to do? So the electronic medical record, which is going to enable us to share information and to keep track of information, nurses are designing those systems, perfecting those systems, and they certainly every day have to work with those systems. So being a nurse informaticist doesn't only include the medical record. What other things are happening when you think about health informatics? Yes? Yes, great. Shortening the time of giving you the process of information. That's right. So your medication orders are digitized. The medicines are delivered to you in a computer-supported way. They're checked. You have to check it against the barcode of the patient to make sure you're giving it to the right person. All of those processes are digitized and computerized to increase safety and efficiency. But I was thinking about something else too. Does anybody have a mobile phone? Does anyone in this audience have a mobile phone? Yes, thank you. If anybody said they did, well, okay, one person doesn't have a mobile phone. That's fine. We've all got mobile phones, and what are we doing about the apps on our mobile phones? Are any of you using an app to monitor, for example, your physical activity? Yeah. Right? Possibly your weight. I should be monitoring my weight daily on my cell phone. So if you are a patient with congestive heart failure, for example, one of the things the nurse who would be caring for you would need to know whether your weight is going up. Because if your weight goes up, the nurse could come back to you and say, the medication that you take that helps you drain fluid so that your heart works more effectively, you need to crank up that medication a little bit. How about if that were on an app? Patient steps on the scale delivers weight to phone, weight is transmitted to nurse, monitoring it in office. Nurse says, oh, look, Mr. Jones's weight went up 5 pounds last night. He needs to crank up that diuretic medication that he's taking. Nurse communicates with patient. Maybe it comes back as a text. Mr. Jones, I think did you eat black bean soup last night and get a sodium load that put you up over the top? Maybe you need to take a little bit more of this medication, or you need to lie down and put up your feet. So apps, right? Health applications that nurses are going to design and will monitor are part of being a nurse informaticist. Case manager. It's really kind of a terrible term for, we should call it something better, like totally caring, warm nurse who looks out for all aspects of your care. A case manager can work, a nurse as a case manager can work for a number of different kinds of institutions or businesses to be in charge of a whole case of a patient. So say, for example, you have a terrible injury on the job and you have a period of rehabilitation and physical therapy that's slowly going to bring you back to work. It could be that company, the Boeing company, for example, would have case managers, nurse case managers in their employment, who are the people who monitor injured employees and see that they come back to work, that they're getting the right physical therapy, that they're following their physical therapy regimen, and that they can return safely to work. Nurse case managers Now you can imagine it could happen, right, that you could be a nurse case manager and you might pay a home visit to a patient. You might come in and see their home and see what the situation is like with their food and their big dangerous dog and their old pile of National Geographics in the corner that they're going to fall over and break their hip. You might come in and look at those items, but some of your case management could all be taking place electronically, right? You could have a video hookup with your patient and check in with him or her at regular intervals and do your case management digitally. So you can see that case management and nurse informaticist could actually go together, right? So don't fail to master your computer skills, future nurses. You could be a care administrator of any kind. For example, you could work in a hospital or other care setting that had a particular group of patients, say young people with cystic fibrosis. And those young people with that serious chronic disease need care when they're in the hospital, but they need care when they're out of the hospital. They need somebody to be in touch with the school teacher. One of the biggest problems for young people with cystic fibrosis is going to school and handling the accumulation of fluids in their lungs and other parts of their body that is one of the consequences of this serious disease. There's a lot of management issues with teachers to be able to let students cough up their secretions. Can you imagine what a problem that is in a classroom of second or third graders with one little kid who has some big, terrible, raspy cough and is coughing up all this junk? What could happen with relationships with the fellow students? What could happen with relationships with the teacher? The nurse, the cystic fibrosis care manager nurse, is the kind of person to come into the school and say, teachers, I want to show you a little bit about what cystic fibrosis is like and talk with you about how you could make it so that Timmy, when he's in class, can exit quickly and go out in the hall and cough and do what he needs to do so that his fellow students don't make fun of him, right? So that we prevent bullying of this sweet little kid who just has a problem with a thing that other students may find gross. That's the kind of direct, down to the line stuff that a nurse who knows about cystic fibrosis, who knows the condition of cystic fibrosis, but can bring that knowledge to this practical setting in a school, for example, as a care administrator for a group of students with cystic fibrosis. So if you want to be on the business side, you could work for an insurance company as a nurse, and tons of nurses do. They work as people who analyze data about illness. They work to make sure that claims are being processed properly. Some nurses go ahead and have other training, such as public accountancy training, that enables them to go into businesses like insurance companies and become the people who really know how to manage these complex situations. Why would it make sense for an insurance company to hire a nurse to look at medical claims as opposed to somebody who's just got a degree in finance? Yeah. To understand items on billing, sure. Yeah, to know the terminology. What else? Why would it make sense for an insurance company to hire a nurse as a claims analyst? Because she knows about illness and suffering, right? She knows the conditions. He or she would know the conditions that are being dealt with and know some of the complicated difficulties of working with those conditions. It makes nurses especially valuable employees for the business that's looking at the finances. And of course, nurses are researchers. Some of you may have come yesterday to my colleague Janice Bell's session on nurse research. Nurses do research all the way from how the body reacts to sleep, all of the physiology, the chemistry, the biology, the microanatomy, to social science research that nurses do, thinking about that child, for instance, the child with cystic fibrosis in the school setting, and what the school can do to make that experience for a young person as beneficial as possible. And one of my favorites, working as a public health nurse, working for public health districts and public health programs in the community, from flu shots to water safety to school health to flu shots to cold, to prevention of colds, teaching little kids how to wash their hands, having the fun of going into the 3rd grade and showing kids what kind of junk is on their hands if they don't wash them properly, and then teaching them how to actually washing them while singing Happy Birthday twice. Do you know that's how long you're supposed to rub your hands? You're supposed to sing Happy Birthday twice. No one, of course, ever does that, but it's one of the things that the public health nurses work away at. And of course, there are many nurses who work in our corrections system. Depending on the parts of our state that you live in, the corrections business can be the mainstay of that town or city. And corrections and the health of our increasingly aging prison population is largely the work of nurses. The corrections system is increasingly based on providing primary care that is delivered by nurses to the inmates of our prison system. It's their constitutional right to care. And you may know that California has recently been in quite some trouble about not providing what's considered constitutionally appropriate care, health care to prisoners. And nurses are part of that huge improvement project that's being worked on in the California corrections system. And of course, nurses are educators. Now, most nurses will tell you, I'm an educator in my job every day, no matter what I do. But there are some nurses who spend their time wholly on doing health education. So many hospitals and other care institutions, for instance, will have a resource room to which patients and families come to learn about the conditions with which they've been diagnosed and to get advice and help about how to care for it. So I'll tell you a sad and troubling story, or a troubling story because it's sad, but a good story about the work that a nurse did who was a health educator. She ran the resource room of a large public hospital in Washington State. And it was her job to spend some parts of every day in the resource room greeting families as they came in. And usually people just sort of dropped in, but every so often somebody would come in who had just gotten some terrible news. Terrible news. For example, in this one case, you have a fatal brain tumor. So I don't know if any of you have ever had a day as bad as that, but to have that news come to you from the neurologist in this case, to hear that you have essentially an inoperable brain tumor. And for reasons that aren't clear, the patient left that encounter with the physician and her ride wasn't there. So she's just received this terrible news. She's been told she needs to come back in a couple of weeks and see the physician again. But can you imagine going home with that news? What would you do? She's waiting for her ride. So as it happens, she sees the resource room and she walks into the resource room and the health educator nurse is there. Woman's obviously distraught. And this fabulous nurse says to her, well, what's going on? They sit down and they have a conversation. And the nurse learns about this terrible news that the patient has that the woman has received. And because she was a skilled nurse, she said to her, "May I call you tonight and begin to talk to you about how you would like to learn about your condition. And the woman said, yes, I would like that. So the nurse began a relationship with her, feeding her information in the ways that she wanted it, not delivering it all at once or delivering it in a stupid way. She wanted the patient wanted to read a few articles, not too many, about her condition, and she wanted to get in touch with some other people who had this same very serious brain tumor. The nurse arranged that for her. Now, the woman also went online. And if any of you have looked up health situations online, you know that you can get a mass of information, right? Some of it is probably good, some of it is probably untruthful. So she got a bunch of information, including an ad to come and get a miraculous cure for this brain tumor. Now, these are very difficult situations, but I think it's fair to say that that advertisement for the miraculous cure was not going to be able to deliver what this woman would have ended up paying for. The nurse educator was so skilled at this that she just helped the woman gather a little bit of information about this organization, and in the end, the woman did not pay tens of thousands of dollars to go for futile treatment, but instead established the goal that she wanted, and the goal she wanted was to see her two little boys enter kindergarten. And she lived long enough to be able to do that. That's the work of a health educator who understands how serious this condition was. She never said to her anything as stupid as, "You're going to be okay," because this woman was not going to be okay. Instead, she worked with her as a dignified human being and helped her realize the goal of her sadly shortened life. On the brighter side, you can be a health coach. So we're doing a lot more now about realizing that when you can say really stupid things to people like, "You should lose 25 pounds. What a stupid thing to say. If somebody said to me, "You should lose 25 pounds, I'd say in my mind, "Well, of course I know I should lose 25 pounds. Do you think that what you've just told me is going to help me lose 25 pounds? So instead, we have much more education about how people slowly can change their behavior and regain health. And our health coaches, our nurse health coaches, work with chronically ill people, for instance, people with diabetes. They work with people with congestive failure. They work with all number of people, helping them make slow, steady progress toward a health goal. It's a huge business. It's growing in both public settings and private settings, and people are setting up health coaching businesses all over the place. Another thing a nurse can be is a policy analyst. So here we are in Sacramento with health policy legislation happening every day. There are nurses working in state and federal governments, and they do policy analysis to help us discover whether our tax money is going to programs that work or to programs that don't work. For instance, in Davis, we've just had a big controversy about fluoride in water. I don't want to start that controversy in this room right here, but needless to say, some of you may be surprised that there is still any controversy about fluoride in water, but there is. And nurses are the kinds of policy analysts who can look at the data and help people decide whether fluoride is safe and worth it. You can ask me later what my opinion is about that. You can be a nurse architect. You can be a nurse engineer. You can be a nurse software designer. We have all those things. Nurse architects, for example, are the kinds of people who figured out how to build hospices. How do you build a building where people are going to die and their families are going to be with them as they die, that supports them but does not treat this as less than the significant event it is? There are actually nurse landscape architects, and one of the most interesting of those is a nurse who designed a garden in a hospice. You have to have a very special kind of garden when you're dying, because certain smells, especially if you're on chemotherapy, can be so powerful and so nauseating that you wouldn't want to have those very strongly scented flowers in a hospice garden. In this particular garden, which cared for patients who were dying from AIDS in the day, many of them were losing their vision. And one of the benefits of being outside in the garden was to be able to touch flowers and plants that were interesting to touch and satisfying to touch. So this nurse landscape architect designed this beautiful garden with gentle scents, things that rustled, kind of clanky grasses that rustled, so you could hear the wind even when there was just a little bit, and then the paths followed, and they needed to be wheelchair accessible, of course, plants that you could reach out and you could touch, things like sage, for example, and then you could smell a little bit of that and get that pleasant smell. Very complicated and interesting architecture, engineering, and software design, all of which have to do with health. And there are nurses increasingly going into all of these fields. So that tells you a few things about what's happening in the future of nursing. In the few minutes we have left, I'd love to answer people's questions. Yes? Right. We don't have many orphanages anymore, and that's a good thing. There are certainly nurses who work in special hospitals for the developmentally disabled, for example, or other settings like that. And there they cared for the health of the people who were in those institutions, in those schools. Yes? The question is, if you want to be, I was sorry I didn't repeat that other one. I should have repeated that, I'm sorry. The question is, if you want to be a nurse architect or a nurse software designer or a nurse whatever, how many degrees do you have to have? My suggestion to you is first become a nurse. Then figure out where you're going to live. Once you know those two things, then you can figure out what the opportunities are for you. And it could be that if you, for instance, with the case of the nurse landscape architect, I'll just tell you her story. She was a nurse. She was a hospice nurse. She became so interested in this idea of designing gardens for the dying that she went and took a short course. She didn't do a degree in landscape architecture. She just took a short course in it. She felt that she would be able to get enough business, and it's turned out that she is able to do that with a short degree of training as a landscape architect, and her basic nursing education and her experience. Some of this is talking your future employer into it, into letting you, for example, as a nurse architect, it's very common as hospitals build or remodel. Panels of clinicians, including nurses, are on advisory boards to the architecture firms. And that's been a place that a number of nurses have then decided, oh, I'm really interested in architecture. Some of them have gone to architecture school, which is another whole time and expense, and then some of them have just decreed themselves as architecturally savvy consultants to hospitals who are going to remodel. So I would say investigate first, pay later. Do you know what I mean? Sort of see what's possible before you feel like you have to get a whole lineup of degrees and then say, I'm baked. Go ahead and be pre-baked. Go to those places and see what they tell you you need. Yes? What kind of entrepreneur opportunities are there for the public health nurse? Well, entrepreneurial opportunities for nurses are, I mean, there are a million of them. One of the ones that pops into my mind right away is the nurse consultant for geriatric care. So your mother lives in Florida, you are here in California, mom is declining, she doesn't have any family there in Florida. You need to figure out what she needs in order to stay safe at home and plan for the next steps. You could hire a nurse geriatric consultant who runs a business, going into people's homes, assessing the situation for your loved one, and coming back to you and saying, here's the situation with your mom, her diabetes is out of control, but you worried that she was demented, she's not, or she's able to do these things. She would do a thorough assessment and then help you see what kinds of services you could get for her, what services were available, and what different levels of pay would be called for you to meet that with her. In the public health realm, public health is a little bit different than that, because public health issues are the things that are supposed to come to us because of our tax dollar, right? We pay for clean water. We pay to have everybody get vaccinated, for instance, to have vaccine programs. We pay to ensure some basic level of public sanitation that a public health department is responsible for. So the entrepreneurial opportunities there are probably, I wouldn't call them entrepreneurial, I guess I would call them sort of program opportunities. You could be a public health nurse and you could decide to yourself, wow, these children here in Merced, I'm just making it up, I don't know anything about whether Merced has this or not. These children here in Merced are really not getting dental care. It's a huge problem with dental caries in this school. How do we get some dental money into our strapped schools here in Merced? So that nurse would write a grant, for example, to one of the many foundations in the state that might support that kind of thing, or contact the dental association and see whether she should get something like that going. So I guess I wouldn't call that entrepreneurship, right? I would call it hustling. Yeah, I'd call it good hustling. Yes? The question is, would I say that networking is really important? And the answer would be, yeah, sure. But that networking can start immediately. It can start before nursing school. It should certainly happen in nursing school. It's good to hustle. It's good to say, in your first semester of nursing school, to say, boy, I am really interested in public health, and as I look ahead here, it doesn't look like I'm going to get as much public health exposure as I want, so maybe I will call up my local public health department and say, I am a nurse with an interest in public health. Who's the head of public health nursing in Stanislaus County that I could come over and talk to? There's a fine line between being obnoxious when you do that and just being interested. And I would say that it happens much more that people are not as audacious as they should be. It's great to get a call with some young person or even middle-aged person saying, I want to be a nurse and I'm interested in knowing what the possibilities are. That can make a person's day. And the worst she could say was, no, I don't have time to talk to you. Are there other questions? Okay, well, I want to urge,
Earlier you mentioned about clinical specialists in nursing. Could we also specialize in emergency medicine, and we have to go back to school to do that, and how long would it be?
Usually that happens through the workplace. So after you finish your basic nursing education and you strive hard to get in a place in the emergency department. Once you're in the emergency department, then so-called in-service education, education that you do as a part of your job, or other possibilities can help you become specialized in that. Normally, if you do not yet have a master's degree, you might go back to school and get a master's degree in some aspect of nursing that would add to your specialization there. And there are special master's degrees that let you become a certified specialist in various areas. So we can talk about that specifically, and you just look at the programs that you're interested in to see if those particular specialties are available. Okay, everybody, I hope everybody goes out there and becomes a fantastic nurse. It's a profession that's waiting for you, and one thing we really need are people with a lot of gumption and pizzazz. So let that be you. Thank you.